Hi, guys. Welcome to another episode of Head to Total, the podcast where we pull back the curtain on all things medical. My name is Colleen Young, and as we say back home in Pittsburgh, Pennsylvania, welcome yins, guys. Today, we have with us the infamous Dr. Peter Lasater. Infamous because we know him from the Punchki Run here in Southeast Michigan. He is a TikTok sensation. He is an Instagram sensation. He is everything orthopedics. Now that I've talked you up, Dr. Lasater, good luck. Take it away.
Well, thanks. That's quite the introduction to live up to. I hope I can do it justice.
We have to be witty. We have to be entertaining and educational. There's a lot of pressure on us today.
Yeah. Well, maybe 2 out of 3. We'll try.
Okay. Oh, well, we'll take what we can get. Yeah. So I want to jump right in with Dr. Lasater. For those of you that do not know him from his social media presence, his web presence, Dr. Lasater is an orthopedics professional from Mendelsohn Kornblum Orthopedics here in Southeast Michigan. He is actually the featured sports medicine doctor. So let's jump right in. Dr. Lasater, you're originally from Michigan. And why orthopedics? What's all that about?
Yeah, so orthopedics was, I think, something that drew me in first when I was deciding to go into medicine. I think my first real exposure to it was before I even started medical school. When I was in college, I shadowed a orthopedic surgeon in town where I lived, and I got to see some orthopedic surgery, which was a really cool experience for me. So I think the first surgery that I ever got to see was an orthopedic surgery. And that really not only got me interested in medicine as a whole, but I think that first exposure really kind of tied me into orthopedics. And then, as you get into medical school and you're learning about all the different specialties and things like that, orthopedics was kind of always in the back of my mind as something I was really interested in. And then I got to get more exposure and experience doing rotations as a medical student, and really just kind of fell in love with the specialty. I think it kind of incorporates a lot of things that appeal to me, in that, I did go into sports medicine, and I've always loved sports from a young age. But I think overall, orthopedics is just appealing. And I think a lot of people probably will agree with this, in that it's just kind of one of those things when you're in the OR and you get to see it, it's just fun and it's cool, and you get to use power tools, saws, drills, things like that. And it just seems like when you're first seeing it, you feel like you're seeing something that just shouldn't be allowed. And you're like, wow, this is really kind of how they do this type of thing. And, the atmosphere and the personality of the other people that I met in the specialty, I think kind of meshed well with me. And I kind of saw myself fitting into that way. So
let's talk about, all right, you went to Baylor, correct me if I'm wrong. Okay. All right. Is that where you really started to say, direction is sports medicine. I know I'm going to be good at this. I can help a lot of people. Or were you like, maybe I'll do this?
Yeah. I mean, I think at that point, when I was in college, that was when I was kind of just making the decision to go into medicine. And then I actually, that first experience I had in the OR with orthopedic surgery, I think was during a summer back home in Michigan that I did that. And, when I was in college, and that was the point where I had orthopedics in my my thoughts. I wouldn't say I was dead set on sports medicine at that point. And probably at that point, I didn't have a good grasp of how the field of orthopedics worked in terms of the subspecialties and the all different directions you could go. I think at that time I just knew I was interested in it.
Dr. Lasater then goes and he works for the Minnesota Twins. what was all that about? How'd that happen?
So, I said my dad's side of the family has ties to Texas. My mom's originally from Minnesota, so her whole side of the family is still in Minneapolis area. But I ended up doing my sports medicine fellowship 2 years ago now. I finished up in Minneapolis with the University of Minnesota in TRIA Orthopedics. And they have, as part of the fellowship, we work with fellows with the Minnesota Twins. So it was an awesome experience. I helped out with the Twins at the tail end of the would have been 2019 season. So kind of right after we start fellowship in August, I started helping with the game. So they are one of the physicians who worked with our fellowship had been the Twins team doctor for many years, like over 25 years since the early 90s, I think. And he was kind of the person that we worked with. So, go to the games, go to the clubhouse before the game. Sometimes we see a couple of the players if they're having any issues or soreness. Go over any recent injuries or anything like that. And it's a real fun environment to be able to just be in the clubhouse and be with these major league players, just kind of walking around everywhere. It's a lot of fun. And then being able to be at the games, and we either if there was something that we had to address acutely, down in the training room at times during the game. Sometimes you're up in the press box with the press just watching, and if something happens then you have to go down. But I really enjoyed it. It's a fun environment to be in, and when you're at that high level of competition, the most minor little sprain or strain can be a big deal and is taken very seriously. So you really have to be cognizant of what's going on and how you're treating the players and things like that.
That must have been great training, because I'll tell you what, I think when I've talked to some of your patients, the response I get is he's so attentive. He knows absolutely how to treat me the right way. So that must have given you great experience working on finely tuned athletes. What was the biggest, the most, I don't want to say popular, but the most frequent injury that you saw while working with the Twins?
I'd say it probably just things related to players throwing arms, whether it be just like a tendonitis type thing from overuse. But, when you have overhead athletes and you're, having these players who are doing this repetitive overhead motion, it causes different things in the shoulder and upper extremity. So I would say that was, usually the most common thing that we see, whether it be in pitchers or just outfielders. Obviously there's other things throughout the body that can happen too, but in baseball players in particular, the throwing arm is something that we're always paying close attention to.
Do you find that those of us in Southeast Michigan, it's just like it's the same type of injury that you're seeing all the time, or finely tuned athletes here in Michigan?
Yeah, I'd say it's maybe a little bit different in the finely tuned athletes, but
in unlike me or geriatric patient. So you have your experience with the Twins, and then you went and you were an on-call physician for the X Games for ESPN. Am I saying that correctly?
Yeah. So yeah, that was also part of my fellowship. So coincidentally, right when I started my fellowship in Minneapolis, they were having the X Games there. at US Bank Stadium in downtown Minneapolis, where the Vikings also play. So the X Games, I mean, they rotate around year to year. And that year they just so happened to be having it in Minneapolis, and our fellowship physician group just so happened to be the ones providing the care. And so, they asked us as fellows, like, hey, do you have interest in covering this? And we're like, yeah, definitely. So got to go to that. And I think kind of the events I was there covering were like the skateboarding, and I think I might have seen some BMX bike stuff. So really, really fun to see these people like going down half pipes and doing crazy tricks on a skateboard and things like that. So
did you do that? Did you jump on a skateboard?
No, I wasn't officially competing, and it wouldn't have been fair. So
yeah. That's a good point.
It would have been fair to the other physicians who would have had to treat me for the injuries I would have gotten.
So then you come to Mendelsohn Kornblum Orthopedics, and you start seeing the patients here. And I've heard that a lot of ACL, MCL, you're the guy, all right? You're the one that we turn to. So is that what you see the most of? And can you talk about some of the complications that, we as not finely tuned athletes, seriously, how do we prevent these injuries? What happens when we have one of these injuries? Walk us through all of that.
Yeah. So, I definitely have seen a decent number of ACL injuries and done a surgery on them. I guess starting from the preventative standpoint, that's a hot topic in orthopedics that's always coming around. And I've even worked with our physical therapy department on possibly setting up like a ACL prevention program. And really, like, the best thing that we know at this point for preventing ACLs is a kind of specific structured rehab type workout program that works on certain things like sports where you're jumping up and landing, working on your landing mechanics, kind of strengthening different areas of the knee that might be weaker. The athletes who are most at risk for ACL injuries traditionally tends to be younger female athletes who play, sports like soccer, volleyball, basketball. And we know there are some anatomic differences in the knee with those types of female athletes that make them possibly more prone to injuring their ACL. So, there are treatment prevention programs out there to work on that. In terms of, the risks of ACL injuries and surgeries, like with any surgery, there's always, the risk of bleeding, neurovascular injury, blood clot, things like that. I'd say the thing that's probably specific to ACL injury would be after surgery. The big thing that we work on for the first, few months really is getting the motion back. And stiffness can be a problem after ACL surgery if you can't get that motion back. The way we combat that is, aggressive physical therapy after surgery. Sometimes if a patient doesn't have acceptable motion of their knee by, a certain time frame after surgery, we have to consider taking them back to surgery and doing what's called the manipulation of their knee, where, we put them asleep and then we kind of move their knee to kind of break through some of the scar tissue. And then we actually have to go back in with our camera into the knee and kind of release some of the scar tissue that's formed inside the knee.
Is it always that the ACL tears, or can I strain it? Are there different degrees of the injury?
Yeah, definitely. I mean, you can definitely get a sprain of the ACL, and if that happens, it's typically not as big of a deal if you completely tear your ACL. Some people will get what we call like a high grade sprain where they actually significantly stretch the fibers, and if the way we diagnose like a complete ACL tear is through MRI, and that gives us a lot of information. And usually it's pretty obvious on the MRI if somebody has completely torn their ACL. If someone comes in and they've just sprained their ACL, the majority of the time we're not rushing to surgery or doing any immediate surgery on that type of thing. Now there is kind of a subcategory of some people who might have like a real bad sprain of the ACL and stretch the fibers out to a point to where the ACL is technically not completely torn, but it's not doing its job. And kind of the way you find that out is just to if the patient has complaints of instability feelings later on, and you can kind of classify that as ACL insufficiency, in that the ACL is not working right, and that's kind of a case by case basis to see kind of what the treatment would be for that.
So I injure myself. I come see you. You say, Colleen, you need an MRI. You do the MRI, and you find out, yeah, well, obviously you've torn that. Is it a scope that goes? What's the surgery like?
Yeah, so we do it through a scope, or as we call it, an arthroscopy.
We slower people call it a scope, Dr. Lasater.
Scope. Okay, I'll keep that in mind. Scope. Okay. So we do it through the scope. We make two little incisions at the front of your knee that the scope goes into, and then there's a smaller incision kind of over the front top part of the shin bone that we have to make to drill some tunnels through the bone in that shin bone. And then also that's the area where we can harvest a graft of like the hamstrings if we're doing that as well. But yeah, the majority of the surgery is seen through the scope using the camera. 30 plus years ago, they used to do ACL surgeries open, and you'll see some people today who come in and say, oh, I had ACL surgery 35 years ago, and they have a huge scar across their knee. And that was kind of before they really developed the usage of arthroscopy and kind of advanced that field.
So what's the recovery like? It's could be 4 incisions, right? About
typically 2 small ones and a 3-inch type incision over the shin, 2 to 3 inches, something like that.
Surgery center or hospital? Is it patient choice? What usually happens there?
Typically,
your living room. Do you just do this in your living room, Dr. Lasater? Is that what
well,
happens?
if I had the setup,
Yeah.
You'd have to deal with my son running around too, which probably wouldn't be ideal. But
it happens.
Yeah, typically we try and do as many of these as we can at our surgery center. We have a good setup. The surgical team there, knows the process and how we do it, and it works well. Every once in a while you have to do one at a hospital, and sometimes that's because of patient risk factors, things like that. Sometimes it might be like an insurance issue or something dictates that, but I'd say the majority we do at the surgery centers and try and do it there.
How so I go I get my MRI, I've torn it, you're like, yeah, we gotta do a surgery, Colleen. We go to an ambulatory surgery center. and the operation takes an hour, 2 hours?
Yeah, I'd say anywhere between 1 to 2 hours, depending
Okay,
on
that's
how
not
much other
bad.
stuff we have to do. If you have a meniscus tear that needs addressing during surgery, that takes time, depending on, are we harvesting a graft? Are we using cadaver graft? Yeah, that's generally the time frame.
What's my recovery like?
So, I tell patients who are competitive athletes generally expect to get back into playing competitive sports around 8 to 9 months after surgery. So it's a long process to get back to there. Sometimes I even tell them, it can be up to a year, 12 months at some point. But that's like the very end of the spectrum that you're trying to get to. For a lot of people who are just, recreational athletes or just trying to get back to normal everyday life and work, it's a couple month recovery. The first couple weeks to, 2 months, you're working on range of motion and getting that back and making sure that's normal, and then you progress to strengthening, because you're definitely going to have a lot of weakness in that leg and the muscles after the surgery. And then if you're trying to get back to a specific sport or activity, you slowly get back into jogging in a straight line. And then if you're trying to get back into a certain sport, working on some sport specific exercises and things like that. But for the person who's not trying to get back into a competitive sport or something like that and just trying to get back into work, it's generally a couple months until, it obviously depends on what the person's work is. If you work at a desk job, you're going to be down a lot less than somebody who's trying to go into a manual labor job.
As I sit on my couch on Sunday afternoons and watch my beloved Pittsburgh Steelers beat up on the Cleveland Browns, somebody then tears or sprains the MCL. What's the difference between the ACL and the MCL?
So the ACL, it stands for anterior cruciate ligament. So it's a ligament which is actually inside the knee joint, and its main purpose is to prevent the shin bone moving forward in relation to the femur bone. So that's its main purpose. It also has, another main purpose or a secondary purpose, however you want to phrase it, in that it helps what we call rotational stability. So kind of the shin bone twisting or rotating in relation to the femur bone. So that's kind of the function of the ACL. If you don't have an ACL, your knee joint moves in ways that are abnormal and it shouldn't, and it can make you more prone to injuring further things inside the knee, whether it be the meniscus on the inside or the outside, the cartilage surface, in the knee joint, potentially other ligaments around the knee. And that's something that we preface to patients when we're talking about doing ACL surgery, and that overall having a intact ACL helps protect the knee. And if you live life without an ACL, especially if you're doing activities that have a lot of cutting, twisting, pivoting, shifting sports, but even just daily life, you're more prone to potentially having injury to the other structures in the knee and arthritis down the line. So that's the ACL. So the MCL stands for medial collateral ligament. And so that's a ligament that's on the inside part of the knee. Sorry, when I say inside, I mean like, the medial side relating to more towards the midline of the body. So it's on a ligament that's actually in the knee joint. And that ligament spans from the inside of the femur bone across the knee joint and down to the shin bone. And its main purpose is to prevent the leg or the shin bone from moving out to the outside of the body in relation to the femur. So if you imagine, I don't know if you can see this, but kind of like, preventing opening of that inside part of the knee joint.
I got one more question about the ACL before we go further into the MCL. You mentioned that when you're in there, sometimes you have to repair the meniscus.
Yeah.
Now, a lot of people I've known have torn the meniscus and they start to hobble around. Can you always say if you tear your ACL, you also have a meniscus issue? Or is it completely separate? It just so happens that you're in there and then you see the tear of a meniscus.
Not everybody who tears their ACL is going to have a meniscal tear or a meniscal injury, but the two do go hand in hand sometimes. So you are prone to also tearing your meniscus if you tear your ACL. Does that happen in every single person? No, but that's something that you always have to check for, both on the MRI and when you're actually in the knee joint during the surgery. Sometimes the MRIs aren't perfect and the meniscus will look okay on the MRI, and then you get in there at the actual surgery and there in fact is a tear. So I would say the two are associated with each other, but it is 100% that they're going hand in hand.
What repetitive motions would I be doing that would injure my MCL?
Yeah, so I would say MCL injuries, like ACL injuries, don't happen as much from like a repetitive motion, but it is like an injury type event. So really like the type of force that will tear an MCL, and also tear an ACL, is force which is stressing that ligament for what it's trying to do its job. So with the MCL, the MCL is trying to prevent the leg from swinging out to the outside part of the body in relation to the femur. So if you have a hard force that puts the leg in that position.
And is it the same type of surgery where you go in with a scope? You're cutting 3-4 incisions and then you're going in with the scope for the repair?
So no, for an MCL surgery, we do that as we call open, meaning we're making incisions and we're visualizing it, just with our own eyes. Now, MCL surgery is a lot less common than ACL surgery, and the reasoning for that is the MCL has a much better propensity to heal itself, and that's based on its position in where it is in the knee. So like I said earlier, it's outside the joint area of the knee, and it has a much better blood supply. So if you tear the MCL, it has a better chance of healing itself back. With the ACL, we call that an interarticular ligament. So the whole ligament is inside the knee joint, and if you tear it on one end, the blood supply isn't good enough in order to allow that to kind of heal itself back.
When I completely tear my MCL, am I walking at all? Am I hobbling? Like, is it an immediate impact where I fall to the ground? Or is it, I don't know, I just come see Dr. Lasater on a Tuesday and it happened on a week before, whatever that answer is?
I'd say if you completely tear your MCL, you're probably going to know you did something. So it's going to definitely hurt. Are you going to be able to walk on it? Possibly, yeah. I mean, possibly not. Everyone's different, and it also depends on, did you injure other things inside the knee? Like, did you injure the ACL or a meniscus or something else? So yeah, I guess I'd say everybody's different, but it definitely would be an injury. Now, if you just have an MCL sprain, where you kind of stress the fibers, but it's not completely torn, that's not going to be as painful or significant of an injury.
So the reason I'm going down that path with you is because I hear that you are working at an orthopedic urgent care, and I'm sure you're going to be seeing a lot of weekend sports activities where someone like myself is usually on the couch just playing softball, and I tear, rip, strain, sprain something. So is this a common type of injury that somebody would be walking into an orthopedic urgent care, either the ACL or MCL? Is that something you would see?
Yeah, definitely. High propensity for those types of injuries to occur with sports or just with, other injury type mechanisms that can occur. But yeah, I'd say that would definitely be something that our urgent care would be seeing and will see.
Any preventative tips that you can give somebody who's, okay, let's say moderately active before they go out and really try to play recreational softball in a beer league or something like that, to prevent, no offense, but nobody really wants to see you for you seem like a nice guy, but
none taken.
I kind of want to avoid it. Yeah.
I'd say kind of the traditional answers you've heard before, warm up as best you can, be sure to stretch. Those are two important things. If you're getting into a sport and you haven't really done any physical activity for a while, and all of a sudden you're jumping in, maybe try and do some training or something leading up to that, so you're not just going 0 to 100 right off the bat. A common question I get is, wearing a brace protects me from injuring my ACL and things like that. Really, in general, the answer is not really. We use braces as a supplement for patients who, possibly consider not having surgery on their ACL if they tear it and they, get back into sports. It can help provide some comfort and stability if they're playing their sport. It's really not going to, definitively prevent you from tearing something. Maybe the only caveat to that is I think there's been some evidence that shows in football offensive linemen, if they wear a brace, it can help protect from MCL tears. And you probably will note if you look at any football game, I don't know about the Steelers because they kind of just do their own thing, but any Detroit Lion offensive lineman, all the players are going to have knee braces on and things like that. So,
on one of our other podcasts, we were discussing braces, and nobody made fun of the Pittsburgh Steelers, by the way, but they were bringing up braces, and they were saying that there is a true difference in a brace that you go to and you purchase at your local pharmacy versus the braces that someone like yourself actually custom fits, makes, and so could you talk a little bit? I mean, there is some value to the weekend softball player that goes and buys a brace at a CVS, but true bracing needs to come from someone like yourself, correct?
Yeah, I'd say, a common thing that I see with patients is a lot of patients come in and they say they've been wearing a knee brace, and a lot of times it's these kind of knee sleeves, or it's like a soft neoprene sleeve that they wear, and some people come in and think that that's providing support. Really the thing that's doing is helping provide compression at the knee, so if there's swelling or things like that, it can help with that. If there's no rigid structure to the brace, like a metal or a thick plastic bar on the side or something like that, it's really not going to provide any significant support. So I'd say that's kind of the number one thing that I try and educate patients on. I'm not saying that the neoprene knee sleeves don't provide a benefit. It's just, a lot of the benefit is it provides compression at the knee and helps with swelling and therefore pain and things like that.
Same thing with like the muscle rubs and things like that. It might give you a temporary relief, but really long term, it's somebody like yourself that we have to come and see.
Yeah. Yeah. I kind of just help and treat the symptoms. So
When I hurt myself this weekend, and we all know I will, is
we'll be
it
here for you.
cold? Yeah, thank you. Thanks, Dr. Lasater. Is it cold? Is it heat? What's the immediate that I should be putting on there?
I'd say the immediate thing that I would recommend would be cold ice to, swelling is going to occur, and the ice and cold will help tune that down. Later on, I don't think it's a bad idea to do a combination of ice and heat. But I'd say that's kind of after the acute injury phase. Really, when something first happens, you want to just get the swelling down, and ice and compression, elevation. Those things are going to be the best thing to help with that. So,
and going back to warming up before you go and play softball or bowl or whatever it is that you do. But is there a significant difference between how you would tell someone who's younger, who is playing baseball, softball on a regular basis, how they should prepare so that they don't get injured,
as opposed to the rec league bowler or something like that?
Yeah,
sure.
Exactly. Is there a huge difference, or is it pretty much the same thing? Is it different in a younger person who is maybe in their late teens and is constantly active versus somebody like myself who is not in their late teens and maybe a little bit more sedentary?
I guess I would say if you're playing a more intense and active sport, you maybe want to spend a little bit more time stretching and warming up. I probably don't see too many people at the local bowling alley, doing 30-second deep squat stretches and things like that. Not that I have anything against that, but and maybe that's what I've been doing wrong with my bowling game all these years. But
yeah, it could be. We should do a whole other podcast. Bowling with Dr. Lasater.
It'd be a lot of gutter balls.
That could be good. So actually, the reason I asked that question is nowadays there's so much pressure on younger people to be great in sports, right? And how soon do they get back on the field? And do you have any, I understand it's a case-by-case basis, but do you have any recommendations for, parents, look out for this, make sure your child is doing this, make sure your child is not doing that?
Yeah, I'd say the thing that I see a lot, especially in younger athletes, is they come in with these overuse injuries, whether that be, patellar tendonitis or, tendonitis in a throwing arm or something like that. And, if you talk to them and kind of get the story of like, well, how much sports are you playing on a weekly basis? How many days are you taking off? How many teams are you playing on? And some of these kids are playing sports, 5, 6, 7 days a week and jumping around to all different teams and leagues. And really something like that is just too much. The body needs time to rest. And a lot of times for these conditions, we can send them to physical therapy and do things like that, which helps. But a lot of times you just have to say, you just need to rest and take it easy for a little bit and not do so much sports. And a lot of times they find that that's a hard thing to come to grips with, because it's always, our team's in the playoffs, and our daughter is like the star pitcher and they need her and things like that. And that's tough to deal with. And I get it. But really it's kind of hard to have to tell them that, you just need to rest and give this time to recover. So
yeah, there's a future after sports, right? There's a lifetime ahead of some of these young kids, and you only get one body. So that rest is really important. So I now understand the ACL, I understand the MCL, and I understand the orthopedic urgent care, because that's probably where I'll be this weekend. Can't thank you enough, Dr. Lasater. Would love to have you back if you're open, not just for bowling, but for some very other in-depth talks about other parts and muscles that you're working on. Because I think a lot of people listening to this podcast, myself included, when we first started down this journey, orthopedics meant bones. And orthopedics meant an older demographic, and you get a vision in your head. And that's not the case. There's a lot more to talk about with respect to sports medicine and things that you are doing in sports medicine. Would you come back and talk to us again?
Let me think about it. Okay.
I don't. Yeah. Oh, the sassy Dr. Lasater. No, great. If anybody needs you, you're all over the web. And thank you for all the community involvement that you've been doing. It really does make a great impact. We truly appreciate it. And Medicine Cornbloom Orthopedics, if they need to see you, or Orthopedic Urgent Care at the Wright Grant Sports Complex, which is amazing.
Definitely. I appreciate you having me. It's been fun and happy to come back anytime.
Thanks. Dr. Lasater. Talk soon.